introduction to endo, and then we will also be discussing hypothalamus and pituitary. Okay, so can I have a show of hands? Okay. Oh, ayan. Okay. So, sinong nakabasa or uh, nakinig? Ayan, may mga nakinig na. Very good. Thank you, thank you. Very good. So we will start with the intro to endo. Mhm. Okay. So let me just tell you what it's all about. So this introduction is all about overviews of and generalizations about endocrine physiology. So in the succeeding lectures, you will be having or you will be discussing specific organs. But for this topic, we will be looking at the overviews or generalizations. Okay. So how do you study this? So of the first part of the lecture, yung part 1 ng video is all about the endocrine system compared to your nervous system. They're both control systems, but um okay. But there's a table there that compares and contrasts the two systems. Okay, so you have there the basic differences between the two. And then you also have to, this is very important, you have to be able to classify the hormones. Okay, now the classification is based on the chemical nature of the hormone. So you have peptide hormones, peptides, protein hormones, which are the most numerous. Okay, and then you have non-peptide hormones. You have your steroids. Okay, you have your steroids and thyroid hormones, and then of course you have your catecholamines. So later on, we will be showing the table that will be comparing all these hormones. So they will be compared according to synthesis, storage, excretion, cellular effects. And if you understand the chemical nature of these hormones, it will be very easy to remember their nature. Okay. Okay, ito yung medyo mahirap. Review of signaling. Right? So in the study of these hormones, you have to review a lot of your signaling. Okay, sana naalala nyo, no? But we in the asynchronous we had a review of signaling. Okay, so there's also a concept map there to make review easier. Okay, and then in part 4, we have the feedback mechanisms. Okay, so we have the positive feedback and the negative feedback, and this is very important. This is very important clinically, so we should be able to understand this also. And then ano pa ba? You also have the endocrine disorders. Okay, so we will be discussing about some basic endocrine disorders. Endocrine disorders will be based on deficiency of the hormone. It's also based on the excess of the hormone, and it's also based on the resistance, resistance especially of your receptors to the action of your hormones. Okay, sorry, nag-admit pa rin ako. Okay, so and then if you are going to, if you have your hormone deficiency or hormone excess, they are further classified into primary, secondary, and tertiary. Okay. Okay, so, ay, naku, nakita yung unang question ko. Sorry, yun na pala yun. Anyway, okay, I'll be giving you 5 minutes to answer poll questions. Nasaan na yung poll? Wait lang. Okay, I'll stop share and then we have some poll questions. Ano to? Um, 5 questions lang ito. Wait lang, I'm looking for it. There we go. Launch. Okay, so can you see the poll questions?
Yes po, Doc.
Okay, sige. I'll give you 3 minutes, kaya nyo na to. So it's 8:38. Let's start at 8:41. There are 378 of us, 379 minus the faculty. So that should be more than 370. Pero ang sumasagot 155 lang. 158. 166. Yung iba tulog pa. Yan, naging 190, 195. Okay, ano bang purpose ng pag-attend natin ng synchronous? May purpose ba? It's 8:42. I will end the poll. Share results. Okay. Tingnan natin ang results. Okay, so in number 1, okay, most of you answered letter B. Okay. So bonus sa kanina, no? Pinapakita ko na yung question. Okay. Ba't ganun? Yung number 2, walang lumitaw na answers. Okay, number 3, most of you answered letter D. Number 4, Most of you answered letter C. Number 5. Most of you answered letter D. Right. So let's take a look at the answers. Okay. So this is question number 1. Which of the following statements concerning a particular hormone is correct? Okay, so let's take a look at option A. It will bind to cell membrane receptors in all cell types. Okay, of course, that's not true. Some 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 receptors are inside inside the cell. So some receptors may be in the cytoplasm or in the nucleus. Okay. So that, of course, the answer is letter B. It is lipid soluble and has an intracellular receptor. Okay. Because lipid soluble receptors can pass through the membrane. Okay. And therefore, if their receptors are inside the cell, they can easily bind to their receptors. Letter C, it circulates bound to a protein and this shortens the half-life. Of course, this is not correct because binding proteins, okay, binding proteins will prolong the half-life. Okay, so in the synchronous session, we defined what half-life is. Okay, so letter D, it is a small peptide, therefore its receptor localization will be in the nucleus. Okay, as we mentioned earlier, if you know the chemical nature of the hormone, it will be very easy to know where the receptor is. So since if the hormone is a peptide or a polypeptide or a protein, it cannot pass through the membrane. So therefore, it has to have its receptor in the cell membrane. Okay, so the answer is letter B. Okay, so this is the um yeah, so this is the table that we showed in the synchronous. Okay, so polypeptide hormones are those hormones that are secreted by the pituitary and hypothalamus. And aside from those, you have insulin, glucagon, and your parathyroid hormone as your polypeptide hormones. Steroids, you have fewer steroids. Okay, fewer steroid hormones. Steroid hormones are secreted by the adrenal cortex, the gonads, and your placenta. And then you have this amino acid derivatives. Yeah, and yung amino acid derivatives will be divided into two. You have those that function like steroids, so these are your thyroid hormones, and there are those that function like peptides, so these are your catecholamines. Okay, kilala nyo na yung ano, di ba, yung epinephrine tsaka norepinephrine. They are they are uh sorry, what is happening? Bumalik. Okay, they are also classified, you classified them before as neurotransmitters, but now they can be classified as a hormone also. Okay, so please familiarize yourselves with this table. This is very important. Okay. Okay. Question number 2. Which of the following would be expected to alter hormone levels? Okay, so letter A, changes in mineral and nutrient plasma levels. Pituitary tumor, transatlantic flight, training for the Olympics, and kanina na sumasagot kayo eh. Most of you answered all of the above, which is correct. Okay, so let's take a look at the options one by one. Okay, so the first option is about, okay, the first option has something to do with changes in mineral and nutrient plasma levels. Okay, so we have this response-driven negative feedback. So under response-driven negative feedback, you have um, this, an example here. The example mentioned here is your blood glucose, which will influence the secretion of your endocrine gland. So we have here, right? So whenever there is this decrease in blood glucose concentration, okay, that will be blood glucose concentration will influence the secretion of your glucagon and your insulin. Okay, so when there is an increase in blood glucose levels, that will stimulate the secretion of insulin. Okay, and then if you have a decrease in blood glucose levels, okay, a decrease in blood glucose levels, then that will be stimulating the release of your glucagon. Okay, so option A is correct. Right. But aside from glucose, you also have some other factors that can influence or that can change hormone secretion, like your uh, sodium and potassium or calcium levels also. Okay, what about a pituitary tumor? Right, so we need to review this. You have taken this up in anatomy, am I correct? Tama ba ako? Sa anatomy na take up nyo na to? Yes, okay. So review na lang to, 'di ba? So what do we have in our hypothalamus? So in the hypothalamus we have this nuclei. Okay, so we have this nuclei and we have this um called the supraoptic and the paraventricular nuclei, correct? Familiar na ba kayo doon? Hello? Are you already familiar with this nuclei, with the paraventricular and the supraoptic nuclei? Ano nga ulit yung nuclei? If you recall, what are nuclei? Who can answer? Ano yung nuclei? What do you remember about about the nuclei? Di ba nuclei are nerve cell bodies within the CNS? Okay, this is in contrast to your ganglion. Yung ganglion naman, nerve cell bodies within the peripheral nervous system. So what do we have here? Ba't bumabalik? Okay. Okay. So what do we have here? We have here the neurons. Sorry, we have here two types of neurons, the magnocellular neurons, and then later on we will see the parvicellular neurons. Let's take a look at the relationship of your hypothalamus to your pituitary. Okay. Okay, so we have here this arteries, the superior hypophyseal artery, and then we also have the inferior hypophyseal artery here. Okay, so we have here the long portal vessels through which your hormones will pass through. Okay, so hormones coming from the hypothalamus will go towards the anterior pituitary, also known as your adenohypophysis, through this primary capillary plexus here, and then it passes through the long portal vessels going towards the secondary capillary plexus. Okay, so dito, okay, the hypothalamic hormones, hypothalamic hormones will be released so that it can influence these hormones in the anterior pituitary. Okay, so initially, these hormones from the hypothalamus were released by these neurons, Okay, they were released in this capillary plexus. Okay, so blood na yun nandun, diba? And then through the blood, the hormones will be delivered through this hormone secreting cells, okay, in your anterior pituitary. These are known as your trough cells or your tropic cells. And then eventually, the cells produced by the anterior pituitary will be released in the circulation. Yan. Okay, so from the parvicellular neurons, there will be axonal transport of the hypothalamic hormones. So what are these hypothalamic hormones? You have your CRH, corticotropin, thyrotropin, you have your GnRH, and then you have your somatostatin and your dopamine. And then through the long portal vessels, they are secreted into the anterior pituitary, okay, to stimulate the release of your anterior pituitary hormones. Okay. Now, what about the neurohypophysis or the posterior pit? Okay. Now, the secretion into the posterior pit it's straightforward. Okay. From the magnocellular neurons, you have axonal transport of the hormones towards the posterior pituitary, and these hormones are your oxytocin and your vasopressin. Now, discuss nyo na yung vasopressin nung sa renal physiology, di ba? We also discussed it under our nung nag-lab conference tayo. Okay, and then they will be secreted into the systemic circulation. Okay, so next, ito yung sinasabi natin kanina, the humoral stimulus. Okay, so we discussed about glucose, diba? Sabi natin glucose can influence secretion of some hormones. And then calcium and phosphate, sodium, potassium, osmolarity and volume can also stimulate secretion of hormones. Okay, so these are humoral stimuli. And then we have neural stimuli. So this is a review of your autonomic nervous system, diba? In the secretion of epinephrine from the adrenal medulla, you have your sympathetic neurons. Yan. Okay, so you have your autonomic nervous system, and these neurons will be stimulating the release of your epinephrine and norepinephrine from your adrenal medulla. You also have the secretion of norepinephrine from the neurons. Okay, and then another illustration of this is what we saw earlier. Ito yung ating posterior pituitary. In the posterior pituitary, we have neurons that will, through which hormones will be released, and they are released directly in the posterior pituitary. Yeah. So these hormones are not produced in the posterior pit. They are produced in the hypothalamus. They are just secreted in the posterior pituitary. And then another type of stimulation will be hormonal stimulation. Nandito na ngayon yung axis, yung hypothalamo-pituitary target gland axis na sinasabi natin. Okay, so examples of this are the secretion of your thyroid hormones, which you will be discussing later. You also have the secretion of your hormones coming from your adrenal cortex and from the gonads. Okay, ito yung tinatawag nating axis. Okay, now what about the yung transatlantic flight na sinasabi natin kanina, no? Now this is something to do with the circadian clock or the circadian rhythm, which you have learned in neurophysiology. So the circadian clock will of course be regulate the coordinated rhythms. So the most important Zeitgeber, of course, will be light, okay, day and night. So it will influence endocrine function, metabolic, and behavioral function. And because also of this, you have the circadian rhythm as far as hormone secretion is concerned. So, ayan merong throughout the day, there are times when hormone secretion will be highest. There are times when hormone secretion will be lowest. Okay, ano ba magandang example natin dito? Okay, growth hormone. Okay, so the growth hormone, yung letter C. Okay, letter C, growth hormone. The highest secretion of growth hormone will be between, ito yan, yung madaling araw, early morning. Okay, so early morning. So look at this, between 12 a.m. to 8 a.m. So before you wake up in the morning, that's the time that you will be secreting most of the growth hormone. And then yung last will be melatonin. So melatonin will be increased, secretion of your melatonin will be increased while you're sleeping. But we're now very familiar with melatonin. Okay, now what about this slide? This comes from an old edition of Byrne and Levy. Ang ganda kasi, ganda nung dami niyang sinasabi. Okay, so what is this telling us? This tells us that there are so many factors that will affect hypothalamic function. And when these factors affect hypothalamic function, they therefore affect also pituitary function. So what are these? Okay, yung inyong sleep-wake cycle, which we have mentioned a while ago. Pain. Okay? Pain will also be affecting the hypothalamus or the hypothalamic centers. You have your emotions, even your vision. So we have these hypothalamic centers. We have this heat regulating center. We have centers that will be regulating energy. We have autonomic regulation, water balance, and metabolism. So all this will be affecting your the endocrine system. Okay, we go now to practice question number 3. Mamaya yung questions. Which statement about hormonal regulation is correct? Okay, a hormone does not inhibit its own release. It does. Okay, it may inhibit its own release. The substrate a hormone regulates does not affect that hormone's release. It does. Diba? Yung kanina, minention na natin yan. Negative feedback regulation occurs only at the level of the anterior pituitary. Okay? So may konting testmanship dito ha. When you see the term only or all, you should think about that option. More often than not, mali yun. But I will show you statements later on containing the word all na tama. Okay? Tama siya. Yung maraming mga all dito. So, feedback inhibition may be exerted by nutrients and hormones. Yes, we have mentioned that a while ago. Ayan. So, this is your endocrine axis-driven negative feedback. Okay, we will be showing you a lot of this in a while. So, first you have your hypothalamic releasing hormone influencing your pituitary gland. So your pituitary gland will be secreting trophic hormones. In some books, this is called trophic. Okay, trophic hormones. Ano ibig sabihin ng trophic? Okay, it's a hormone that influences the release of another hormone from another organ. So we have the peripheral endocrine gland that will be secreting hormone. And then this hormone may exert negative feedback on the pituitary gland and the hypothalamus. Okay, so later on we will be talking about the long loop, short loop, and ultra short loop. Okay, now, yan yung negative feedback, diba? So what about the positive feedback? Of course, meron din tayong mga positive feedback, diba? So in positive feedback, instead of inhibiting, inhibiting the release, for example, of hormones coming from your uh, pituitary or hypothalamus, there is an increase. Okay, there is an increase in the release. Okay, and a book by Goodman actually described this as, yan, no, parang ano daw siya, parang it's a bang. Okay, and this is exemplified, for example, when the baby is delivered, di ba? Paglabas nun, bang! So parang explosive. Okay? So that is a form of positive feedback. Because as the labor progresses, there will be the release of more and more oxytocin. Another example is, which you will be learning in detail in female repro, will be the positive feedback that happens just before ovulation. Okay, so estrogen will be exerting positive feedback on your uh, LH, on the anterior pituitary, so that there will be LH surge, and that will bring about the release of your egg, okay, from the ovary into the fallopian tube. So that's another bang, 'di ba? Nag-explode din siya. Okay? So ang daming magandang example. Okay, so these are the negative feedback loops. So first we have our so we have the ultra short loop, wherein the hormone coming from the hypothalamus will be exerting negative feedback on the hypothalamus. And then we have the short loop. The anterior pituitary hormones will be exerting negative feedback on the hypothalamus. And then we have the we have the long loop. So the hormone coming from the target organ will be exerting negative feedback on the anterior pituitary and the hypothalamus. Okay. So question number 4. The structure of a newly discovered hormone shows that it is a large peptide with a glycosylated subunit. This hormone is likely to, tingnan natin yung mga options, no? Peptide ang sabi eh. It is a large peptide. Therefore, if it's a large peptide, saan ang ano nito? Saan ang receptor nito? Sa cell membrane, because it cannot cross the cell membrane. So, therefore, it cannot bind to DNA and affect gene transcription. Okay? And then, letter B, medyo sabi nyo, uy, protein nito, peptide. So, pwedeng GPCR ang receptor nito, diba? But, what's wrong with letter B? Letter B says that it binds to adenylate cyclase. No, your hormones do not bind to adenylate cyclase. It binds to a receptor. Okay, so letter B is wrong. Okay, letter D, it will be secreted intact in the urine. No, they're not secreted intact in the urine. Remember that yung peptides nyo, no? Especially yung mas malalaking polypeptides, they are not allowed through the glomerular membrane, diba? So they will not be secreted intact in the urine. Okay, so they usually undergo degradation. Okay, number 5. Hormone binding to a receptor coupled, ito review to ha, coupled to a G-alpha S will stimulate or will result in, ano yung mga pagpipilian nyo dito? Ang MPL nito 0.5. Kasi pwede nyong piliin yung letter A. Okay? What makes letter A incorrect? We will see later. Okay. You should surely not choose letter B, yung inactivation of tyrosine kinase. We will see later also why. And increased potassium efflux, hindi rin. Okay? Sige, yung increased potassium or kunyari sodium influx or potassium efflux, this happens in your ion channel receptors. So the answer is letter D, activation of adenylate cyclase. Okay? So review natin to. So when you talk about cell signaling, you have, of course, you have the direct contact wherein the hormones or your signaling molecules, okay, may go through your gap junctions, or they may be plasma membrane bound, or they may be receptor mediated. Right. So receptors can be divided into two. You have your cell surface receptors and your intracellular receptors. As you have said earlier, your intracellular receptors are utilized by hormones that are able to cross through your membrane. Okay, so they may be in the cytoplasm or the nucleus. Ang mas marami yung cell surface receptor cell. So let's take a look at those. So you have the ion channel coupled receptors. Ito yung sinabi natin kanina that will cause influx of sodium or influx of potassium. Okay, ang pinakamarami, will be your GPCRs or your G protein coupled receptors. Okay, so your G proteins are of different types. So meron tayong G alpha S. Ito yung nasa question natin, diba? G alpha S, G alpha I, G alpha olf, G alpha T. Yung G alpha olf, nasa olfactory yon. G alpha T. Ito nasa where is this? In the rats and cones, diba? So G alpha Q, G alpha O, and GIGO. Okay, ano yung question natin kanina? Which we will not, ano sabi natin kanina? Yung phospholipase C. Okay, bakit hindi yun ang sagot? Okay, because phospholipase C is mediated by your G alpha Q or your G alpha O. Okay, and when there is an increase in phospholipase C, you have your DAG and your IP3 and calcium as your secondary messengers. Okay? Review pa rin to. So you have the ligand that will be binding to the receptor. The receptor ligand complex will activate G proteins. Activation of your G proteins will activate enzymes or ion channels. Okay, so your enzymes are in the form of adenyl cyclase, phosphodiesterase, phospholipase C, phospholipase A2. Second messengers, ito yung mga second messengers. Cyclic AMP, cyclic GMP, IP3, DAG, calcium. Okay, and then you have this effectors, your kinases. Okay, sorry, a lot to review. We have a lot to review. Okay, so what about your enzyme-coupled receptors? They are classified as catalytic receptors or cytokine receptors. Okay, so these are your catalytic receptors. Receptor guanylyl cyclase, receptor serine threonine kinase, RTK, receptor tyrosine kinase, and then your receptor tyrosine phosphatase. You also have your cytokine receptors. Saan natin na-meet yung cytokine receptors? Sa immunology. Okay? Ayan. Most polypeptide and protein hormones bind to G protein coupled receptors. Okay? So, how do we use this statement? So let's memorize. May memorizing nyo tayo. Let's know which hormones don't use G protein coupled receptors kasi mas konti yun. Okay, so these are your A and P. Okay, your TGF beta, or your transforming growth factor beta. Insulin, nerve growth factor, IGF, insulin-like growth factor 1, PDGF, or your platelet-derived growth factor, then your EGF, or your epidermal growth factor, prolactin, leptin, erythropoietin, and growth hormone. So all this make use of enzyme-coupled receptors. So all others, GPCRs yan, ha? Okay. And then, of course, we have the steroid receptor family. The steroid receptor family makes use of cytoplasmic receptors. And we have nuclear receptors being utilized by your thyroid hormone, your estrogen, and your vitamin D. Okay? Yeah. Hey, so we go to hypothalamus and pituitary. We showed the relationship between the hypothalamus and the pituitary earlier. Okay, so if you while studying, you can draw this. Okay, so you have to know about the specific hormones that are secreted by your hypothalamus and your pituitary gland. Okay, so the synthesis, the storage, secretion, the systemic effects, and the regulation of secretion will have to be studied also. Now you have your hypothalamic releasing hormones, and there are hypothalamic inhibitory hormones. Okay, you have your anterior pituitary. This belong to the endocrine axis driven control. Okay, so you have the growth hormone, prolactin. As you can see, the other hormones, uh, for example, your prolactin will be discussed again in pregnancy and lactation. ACTH will be discussed again in your adrenal lecture. LH and FSH will be discussed in female repro. TSH will be discussed later, okay? Or has been discussed in your asynchronous. And then we have the posterior pituitary. There are only two, your ADH and your oxytocin. Okay, under physiologic response driven, okay, you have insulin, glucagon, calcium, and phosphates. And then as far as clinical application is concerned, okay, we have hormone deficiencies. Examples of this will be deficiency of your growth hormone, deficiency of ADH, and you have the deficiency of all anterior pituitary hormones. So we call that your panhypopituitarism. You have deficiency or you have excess of your growth hormone and your ADH. We will look at some cases later that demonstrate this conditions. And then there may also be resistance to growth hormone and resistance to your ADH. Okay, so okay, I will stop sharing. Uy, may mga sumagot pala sa akin. Thank you. Doc, effective po ba talaga mga melatonin pills? Yes. Okay. They simulate the effect of melatonin. And as we have seen earlier, melatonin levels increase at nighttime. Okay, it starts to increase when you're about to sleep. Okay, so yes. Okay, so any other questions? Ayan, nerve cell bodies in the CNS. Thank you for those who answered. Okay. So nerve cell bodies in the peripheral nervous system are called your ganglia. Kaya yung basal ganglia, sabi ng ibang books, misnomer daw yun. So it should be it should be named basal nuclei instead of basal ganglia. Okay, so we have part 2. Uy, hindi muna tayo mag-ano hindi muna tayo hindi pa tayo teka nga, wala. Ayun, okay. We have only 4 questions. Okay, maikli lang to. 4 questions only. Kasi medyo mahaba yung ano. Ba't ayaw mag-launch? A poll has been launched. Wait lang. Baka naka-launch pa yung isa. Okay. Tama ba? Naka-launch na? Can you
Yes po,
see?
Doc.
Okay, sige. Thank you. I'll give you 3 minutes. Again, only 85 people are answering. 88, 100, 112. Okay, there are already 432 of us. Okay, it's 9:22. I will end the poll. Ayan. So in number 1, which of the following is an inappropriate, okay, hypophyseal hormone response? Okay, ang in-answer ng karamihan, letter B. Second, let's look at the answer. So maraming sumagot ng letter B at D. Number 3, increase serum cortisol. Maraming sumagot. Number 4, letter E. Maraming sumagot. Okay, so let's take a look at this. Inappropriate hypophyseal hormone response to the hypothalamic hormone listed. Okay, so let's take a look at this. Ano ba itong mga hypothalamic hormone na ito? No? So we have somatostatin, dopamine, GnRH, TRH, and CRH. Okay. Yan. So these are the hypothalamic hormones.
Ellen, hindi ka
Okay.
nakashare.
Hindi ako nakashare. Sorry. Teka mama, babalik ako. Yan. Okay. Thank you, ma'am. Okay, so this is the question. Most of you answered letter B, dopamine and dopamine causing an increase in prolactin. Anong hinahanap natin? Yung inappropriate. Okay, so here is a list of the hypothalamic peptides. So lahat sila protein in nature. Okay? Therefore, all of them will have cell membrane receptors, and all of them will have G protein coupled, specifically G protein coupled receptors in the anterior pituitary. Sinasabi ko na yung mga all na that I was mentioning earlier. So all hypothalamic hormones are peptides or protein in nature, and they all have G protein coupled receptors in the anterior pituitary. Okay. So your TRH will be stimulating the thyrotropes. Okay. In some books, ano to, thyrotropes. Okay, so here we have thyrotropes. And then GnRH will be stimulating the gonadotropes to release LH and FSH. CRH will be stimulating the corticotropes to release ACTH. Ayan, ito na ngayon yung somatostatin, which was mentioned earlier. Somatostatin in letter A, sabi niya, it will decrease growth hormone secretion. Yes, that is correct. So that is not the answer. Okay. What about GnRH? So GnRH will increase LH secretion. Yes, it will increase LH and FSH secretion. TRH will be increasing TSH secretion. CRH will be increasing ACTH secretion. Okay, so what is the answer? The answer which is inappropriate, okay, will be dopamine increasing prolactin secretion, because dopamine will be negative, will be inhibiting prolactin secretion. So that is the answer. Okay? Yeah. Next is a 70-year-old male patient recovering from a surgical procedure complains of headache, difficulty concentrating, impaired memory, muscle cramps, weakness at 48 hours duration. On examination, vital signs are all normal. No signs of dehydration or edema. Laboratory values report serum sodium of 130 millimoles per liter. Which of the following would be compatible with the differential diagnosis of SIADH? Okay? Okay. Tingnan muna natin kung ano ba yung SIADH. So it has something to do with your ADH function, diba? Ako, review to ng renal fissure, diba? So the most important stimulus for the secretion of ADH will be an increase in plasma osmolarity. So if the plasma osmolarity becomes greater than 280 millimoles per kilogram, that will stimulate the osmoreceptors in the hypothalamus. What can give you increased plasma osmolarity? Anong condition? Teka, baka may sumagot sa akin sa... Ay, walang sumagot sa chat box. Review ito. DM, diabetes mellitus, dehydration. Dehydration, yes. So, ibig sabihin kasi nito, dumadami yung ating kumukonti yung ating tubig in relation to our to the solutes in the plasma. So this will stimulate ADH secretion by the posterior pituitary. Okay, and what will be the action of ADH? We review na lang ito, diba? Anong action ng ADH? Uy, nandiyan si Dr. Rabi, sumagot kayo. What's the action of ADH? Ayan, may mga sumasagot na. Thank you. Increase watery absorption by the collecting ducts or the distal convoluted tubule. Yes. Watery absorption via aquaporin channels. Increase watery absorption. Yes. Okay. Thank you. Thank you. Okay. Kasi nandito na, diba? Okay. So, increase water permeability of collecting tubules and distal convoluted tubule. So, that will bring plasma osmolarity to normal. Okay. Ayan, a 1 to 2% change in plasma osmolarity will already stimulate ADH secretion. Okay. It's also known as your vasopressin or AVP. Pag nakita niyo AVP, ibig sabihin arginine vasopressin. Now, vasopressin is also stimulated by changes in blood volume. Okay, so when there is a change, when there is low blood volume, then there will be there will also be a stimulation of ADH secretion. Okay, but it takes around 5 to 10% change in blood volume or extracellular fluid volume. So ADH secretion is it's more sensitive to changes in osmolarity, okay, than blood volume. Okay. Ito na ngayon. Okay, what do we call that exists in ADH? That's called your syndrome of inappropriate secretion of ADH. Therefore, ano mangyayari? Sobrang reabsorption natin ng water. So there will be water retention, hyponatremia, inappropriately concentrated urine. So nung nag-ano tayo, 'di ba? Nung nag-urinalysis tayo. So you got the specific gravity. So ang taas nito, taas ng specific gravity. Plasma osmolarity is decreased. Okay? And this may be caused by CNS disorders or drugs, or this may be caused by tumors. Like for example, your oat cell lung CA. The opposite is deficit. And this is known as your diabetes insipidus. So, diabetes na naman. Okay, so we have diabetes insipidus. This is when excretion naman is secretion, of your ADH is decreased. So, if it's decreased, ano naman to? Very dilute naman yung urine. Very dilute yung urine, so plasma will be hyperosmolar. There will be hypernatremia, there will be polydipsia. Okay, Polydip siya. Parang sa diabetes mellitus, may polydip siya rin, di ba? Now, what are the classifications? Diabetes insipidus may be classified as neurogenic. It means to say that there is a lesion in the hypothalamic pituitary axis, or it may be nephrogenic, which means to say that the kidney is unable to respond to ADH. Okay, so, ay, mali. Mali. Balik tayo dun sa question. Okay? So, anong answer natin dito? Ano bang answer ninyo? Okay, most of you answered serum osmolarity of 275 milliosmoles per liter. Normal ba yung 275 milliosmoles per liter? Is that normal? Normal yan eh. Okay? Normal yan eh. What about low plasma AVP levels? Okay. Pag sinabi kasi nating syndrome of inappropriate ADH secretion, ibig sabihin increase. Okay? So, hindi yung letter A. Okay? Plasma glucose of 300 milligram per deciliter. Okay, ano na to? Diabetes mellitus na ito, di ba? So, the answer actually is letter D, urinary osmolarity, which is more than 400 milliosmoles per liter. Kasi nga, when you have SIADH, you secrete a lot of ADH, you reabsorb a lot of water, and you therefore have a concentrated urine. Okay. So, next question. Ano in-answer nyo dito? Okay, 30-year-old woman. This is similar to the case in the asynchronous. 2 healthy children, no has had no menstrual period for the last 6 months. Pregnancy test negative, not taking any medications, headaches for the past 3 months, problems with lateral vision. Afebrile, normotensive, normal values for glucose, sodium, potassium, MRI, may pituitary mass. Right? So, which of the following is most likely to be present in this woman? Ang answer nyo, increased serum cortisol, increased alkaline phosphatase. Anong answer natin dito? Answer will be hyperprolactinemia. Okay? Bakit hyperprolactinemia? Your increasing prolactin can affect secretion of GnRH. Okay? So if it affects secretion of GnRH, then it leads to it may lead to amenorrhea, okay, and infertility. Ayan. So bakit? The most common cause is prolactinoma. Okay? So but affected yung vision. Now that's because when there is prolactinoma, it may compress on the optic chiasm, and may therefore manifest as deficits in vision. Okay? Kaya affected yung vision niya. Okay? So this is something anatomical. Okay? So this is the most common hormone producing pituitary adenoma is your prolactinoma. Okay, so it occurs in about 40 to 45% of patients. And then you may also have growth hormone secreting adenomas. So you can have gigantism or acromegaly. And then you can also have CRH secreting adenomas. So you can have Cushing's syndrome. Yeah. So practice question number 9. Ano yung tanong dito? Which of the following sets of physiological changes would be most likely to occur in patients with acromegaly? Okay. When it occurs in younger patients, gigantism yun, di ba? So pag acromegaly, usually in adults ito. Anong answer dito? Most of you answered letter E. So let's take a look at letter E. Pituitary mass is increased. Kidney mass is increased. Femur length is increased. Ano ba ang answer dito? Okay? Discuss muna natin. Discuss natin, tapos sabihin niyo sa akin yung answer later on. Kasi mali yung letter E. Okay? Yeah. So growth hormone. It's also known as your somatotropin. Okay? So as we have mentioned earlier, the secretion is increased at night. Yan, no? Ang taas ng secretion niya. So it's very important, especially for growing children to have a good night's sleep. Okay? Ngayon, ang tatangkad ng mga bata ngayon, di ba? Ang theory ko dyan dahil sa ano yan eh, disposable diaper. Hindi na-istorbo yung tulog sa gabi. So, lifetime pattern looks this way. Okay? During puberty, that is when secretion of growth hormone is highest. Ayan. So, what are the effects of growth hormone? You have growth effects mediated by your IGF-1, your insulin-like growth factor 1. Okay? Merong ibang tawag dyan mamaya. We will see later. Okay, so the growth hormone will have direct effects on liver and other tissues, and it will stimulate this liver to secrete this insulin-like growth factor. Okay, so the insulin-like growth factor will then have this skeletal effects and this extra skeletal effects. Okay, so there will be, ayan, these are the growth effects on almost all cells of the body. So there will be postnatal linear growth and somatic development. There will also be lean body mass and bone mass and organ size in adults. Okay, so organ size pala is affected din, no? So this is mediated by your IGF. This is also known as your somatomedin. Okay, so your insulin-like growth factor. Okay, so these are the growth effects. Ayan, ito na. So there is linear growth until closure of the epiphyseal plate. Which means to say that if there is already closure of the epiphyseal plate, there is no more linear growth. So, balik tayo dun sa question, ha? Ayan, sinagot nyo femur length. Okay? So, magbabago ba kayo ng sagot? Sinabi ko na, di ba, mali yung E. So, what will now be the answer? It cannot be A, B. Yan. Very good. Letter D na ang answer. Because there will be no more change in femur length because there is already closure of the epiphyseal plate. Good. Very good. Thank you dun sa mga sumagot. Ayan. There will also be metabolic effects. So there is this diabetogenic effect of your growth hormone. Which means to say that if person has acromegaly, ayan, eventually magkakaroon siya ng diabetes. Okay, and then there will be organomegaly also. Doon sa nagpakita ako ng picture, 'di ba? Doon sa asynchronous, naghiwa-hiwala yung ipin, ang laki ng kamay. Yan. There is increased protein synthesis and deposition, there is increased fat utilization. Okay? So this is the regulation of growth hormone secretion. Yan. So we have the ultra short loop feedback, the short loop, and the long loop. The long loop is mediated by your somatomedin. So somatomedin will exert negative feedback on the hypothalamus and the anterior pituitary. Okay. Okay, so you have your ghrelin that stimulates the hypothalamus. Okay, you also have sleep and stress that stimulates the hypothalamus. Fasting and amino acids will also stimulate the hypothalamus. Okay, increased glucose and free fatty acids will inhibit the hypothalamus. Okay, so ayan no, fasting. So yung mga bata medyo dapat gutumin sila, 'di ba? Kasi mga bata ngayon tataba. Hindi ginugutom. They should have a lot of sleep. They should have some stress also to be able to stimulate the hypothalamus to secrete GHRH, which will stimulate your anterior pit. Okay. Yan. Ito nasa ano to? Nasa asynchronous. So let's answer this together. Okay. Nuclei. Yan. Nuclei in the hypothalamus called blank synthesis various hormones that act on the anterior pituitary. Ano yung nuclei yung sinabi natin kanina? Ay, wait lang, may question pala. To clarify po. To clarify. Had the question been gigantism? Yes, you are correct. May question kasi, sabi niya. To clarify po, had the question been gigantism, E would be the correct answer po. Yes, E would be the correct answer. If the patient has gigantism instead of acromegaly. Thank you. Okay, let's answer this all together. Nuclei in the hypothalamus. Ano yung mga nuclei? Very good. Supraoptic and paraventricular nuclei. Hormones that stimulate the anterior pituitary. Hormones that stimulate the anterior pituitary to secrete its hormones are, okay, releasing hormones. Good. Hormones that suppress are called inhibitory hormones. Uy, dapat alam nyo kung ano yung releasing, kung ano yung inhibitory, ha? Okay. Inhibitory, mas konti yun. Number 2, these neurons called, let's take a look at number 2. These neurons called blank in the nuclei release their hormones into the system of capillary vessels. O ano yung neurons? Yung kaninang sinabi natin. The magnocellular and the parvicellular neurons. Yes. Okay. Specifically the parvicellular neurons. Release the system. Release their hormones into a system of capillary vessels called the, anong capillaries to? Doon sa number 2, look at number 2. Primary capillary plexus, correct. Located in the, saan located yun? Okay, doon sa median eminence. Ito yung infundibular stalk. Okay, median eminence, correct. Okay, so let's take a look at number 3. From there, the hormones are transported in the blood through long ano? Long portal vessels straight to the capillary vessels called, ano na yung capillary vessels dun sa anterior pit? What do you call the capillary vessels in the anterior pit that surround the trough cells? Secondary capillary plexus. Correct. Okay, and secrete anterior pituitary hormones. Examples of these hormones are, the examples ng hormones na to, TSH, ACTH, LH, correct. Okay, release of hormones through number 4 affects target organs like Anong mga organs? Yan, ovaries, testes, thyroid glands, adrenal cortex. Kidneys? Bakit kidneys? Not kidneys. Yes, yung kidneys kasi 'di ba ang mag-a-affect niyan yung ano natin, ADH, 'di ba? Eh galing sa posterior pit yun. Yes. Correct. Correct. Okay? So ito naman ang inyong TSH. Ba't ko pinapakita to? Okay? TSH stimulates all events involved in thyroid hormone synthesis and release. Okay, so TSH or thyrotropin is similar to your LH, FSH, HCG in that they have alpha and beta subunits. Ito, ganito yung structures nila. Okay? Nagkakaiba-iba sila sa beta subunit. Alpha subunits nila pare-pareho. Okay. Okay, ito pa ang isang all. Hypothalamic hormones. I have discussed this earlier. Hypothalamic hormones, the receptors are all GPCRs. Okay? Pero may exception ito ha. All secondary messengers are cyclic AMP except yung TRH tsaka yung GnRH. Okay? Uy, tatanong ko yan. All hypothalamic hormone receptors are GPCRs. Pero pag sinabi ko, all hypothalamic hormones have cyclic AMP as second messengers, mali na yun. Diba? Mali na yun. Kasi yung iba, iba ang second messengers. Okay, blank na eh. Ibig sabihin tapos na. Wait lang. I'm checking the chat box. Baka merong questions. Okay. Please answer the concept check questions. Okay? Pag may sinabi ako sa concept check questions na sagutan nyo. Okay? Kasi doon ako kumukuha ng questions. 'Di ba? Lessons learned. So, yan. If you don't have any questions, Dr. Chua, it's 9:50.
Mhm.
So, Dr. Chua, you want to have a short break?
Sige, siguro 10-minute break.
Okay.
Let's start at 10 o'clock.
Okay. See you at 10 o'clock. Thank you. If you have questions, feel free to ask your questions sa discussion board.